My hearing isn't very good, um, and I work at a call center, so the fact that my hearing isn't good is it's not very good for the work that I do. But I'm just thinking in this time of recession when there are so few jobs available, and people have very few choices to work at the job that they like. Um, it's not easy to get the kind of job that you want or that's at least good for your health. Sometimes people take jobs that are not good for their health. It's not compatible with their health. Like if your hearing isn't good, it's probably not a good idea to work at a job that require on a lot of hearing because it may damage your hearing or if you're physically not very healthy or very able, then you should not work in jobs that require a lot of physical labor. So I'm thinking in a recession, there must be a lot of people who are not healthy or under a lot of stress, a lot of mental strain, depression, a lot of problems, a lot of illnesses. So I'm thinking that U.S. The system in Canada is far from perfect, but if you're sick, you're at least able to get healthcare if you want. And a lot of times, how if you have unprotected sex and you're afraid that you have HIV and you don't want to go for testing, I'm not saying I have any. I'm just saying that, a lot of times if you're afraid you have STD, if you get STD and you don't want to go test it because you don't want to know what your problem is because you don't have time to deal with it. I would imagine it's very stressful to even if the doctor is available for free, that sometimes you don't want to go to the doctor. You don't want to find out what's wrong with you. And I have the same problem. I don't really want to go if my hearing is not well. I don't really want to do a hearing test. I don't want to know how good my hearing is because I don't want to know how much hearing I have lost. I don't want to know. So people don't want to know already, even if the doctor is available. So when the doctor you have to pay for it, there even is a larger discouraging element for you to go to seek any help. So I'm thinking a system where all the healthcare system is privatized, where you need to pay to see a doctor, that a lot of people in the US with mental problem, depression, or anything like that, already very hard to get work on their own. If they don't have the healthcare they need, if there's something wrong with them, or they're not feeling well, that is not physically obvious. A lot of these problems may not be treated because they don't have the money to go to healthcare, even if they want to. So I'm thinking there are a lot of people who must be really sick in the U.S. And not sick as in it might not even be obvious. I might have depression, and you don't know if I have depression or not. You don't know that if I'm on pills, if I have seen a psychiatrist, you know, in order for me to go work, or you don't know if I have social anxiety or something, if I can't sleep, or I just can't even go out, and sometimes, fear of people, fear of whatever. It's a real problem. And even in Canada, it costs money to just fill out prescription, to just take medication. It costs money to buy it. It might be free to see a doctor, but it costs money um, to seek medication. So I think healthcare is a very, very important thing. And, besides the fact that it should be available to all citizens, even encouraging people to seek for healthcare, even encouraging people to see a doctor regularly, examine their breasts or examine their prostate or whatever. It would be very difficult just to get people to do that on a regular basis. So not to, to the fact that the U.S. It costs money. I just can't imagine how many people must be sick or living in misery.